Hi, I'm Dr. Dan Greenwald. There's been an increased emphasis in the last couple of years on non-invasive procedures in plastic surgery. These are important to consider because they're less expensive, have less risk, and can typically be performed in the office during an afternoon. Most of these procedures involve some kind of injectable material. Commonly for wrinkles, we use Botox. Botox is a muscle poison that's perfectly safe to use that for a short time paralyzes muscles and keep wrinkles from forming. This isn't the whole story, however, because keeping a wrinkle from forming isn't the only thing we want to do. We want to keep the wrinkle from coming back again after the Botox has worn off. For that reason, we can use filler materials that actually thicken the skin and keep the creases from forming when the Botox is gone. Now, there are several types of fillers on the market that can be used, and they need to be used selectively because not each one can be used in every area. For instance, a woman who wants to have plumper lips would be a very good candidate for what we call hyaluronic acid fillers like Restylane, Juvederm, or several others of that type. These are soft, jelly fillers that have very little complication, very little risk. They last about 8 to 18 months depending on the material, and they don't cause lumps or bumps when applied correctly. If you want to do something like enhance the cheek area under the eye, for instance to take care of dark shadows, Restylane wouldn't be appropriate. It's too soft and doesn't last long enough. For this area, something longer lasting like Radius is appropriate, which is placed deeper in the tissue and lasts up to 2 to 3 years. If you've had Radius and you like the result and you think it's what you want to do long term, you can go to a permanent filler with something like Artifil, which will last 10 to 12 years, if not forever. Now the caveat with any of these is the results are completely operator dependent. I recommend board certified plastic surgeons who've had a lot of experience in this arena. And once again, be sure to look for pre- and post-op pictures so you can see the kind of results you can expect. I'm Dr. Dan Greenwald.